Hi, good morning. I'm Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness here in New York City. It is 10:15 a.m. Friday morning, March 31st. Tomorrow it's supposed to be 70 degrees. Yes. Um, so I'm a licensed and board certified acupuncturist, a board certified herbalist, and I've been treating couples with fertility challenges for more than 2 decades. And of course, many of my patients have had failed IUIs and failed IVFs, or they've gotten pregnant and miscarried. Of course, many of them conceive with IUI and IVF, but many of them don't. And I guess the question is, why not? So it's either poor egg quality, poor lining quality, poor sperm quality, or perhaps it's none of those things. Perhaps it's some underdiagnosed pathology. Uh, for example, a woman can have ureaplasma urolytica, which is a sexually transmitted infection with no symptoms. This will allow her to get pregnant, but she'll inevitably miscarry. Polycystic ovarian syndrome patients, of course, can get pregnant with intrauterine inseminations with Clomid or letrozole. But because many PCOS patients have an abundance of testosterone in their follicles, it negatively impacts the egg quality. So these PCOS patients get pregnant and then they miscarry. Let's talk a little bit about the endometriosis patient who can't get pregnant, even though she has good tubes. So why isn't she getting pregnant? She had a laparoscopy, all the endometriosis was removed, and she can't get pregnant, or she gets pregnant and she miscarries. Why? Because even when a patient has a laparoscopy, there's still endometriosis left in the pelvic region, because some endometriotic tissue looks exactly like normal tissue. And so there's still inflammatory proteins circulating in the uterus, causing a hostile environment in which an embryo is supposed to implant. And it either doesn't or it does, and then unfortunately she miscarries. So acupuncture and herbal medicine are very effective at balancing the hormonal environment, stimulating blood flow, oxygen, hormones, electrolytes to either the ovaries or the testes, delivering more of the good and excreting more of the bad. What's the bad? The bad is dead cells. And of course, your beating heart does this. Your heart circulates blood through the body. But when you use acupuncture and herbal medicine, you're targeting some very specific areas of the body, in this case, the ovaries or the testes. So, the whole objective of acupuncture and herbal medicine is to either improve egg quality, lining quality, or sperm quality. And this obviously will help a patient get pregnant and stay pregnant. You have to realize that in IUI protocols or IVF protocols, nothing is ever done to improve sperm or egg. It's just you retrieve an egg in an IVF cycle, you fertilize it and transfer the embryo, and it's either good or it's not. So, what acupuncture and herbal medicine and low light level therapy allow is for the improvement of the necessary components before you do an IUI or an IVF. In fact, many patients have gone on to conceive under my care without even making it to IUI or IVF. And then there's always the potential of miscarriage. So, why does miscarriage happen? Well, miscarriage happens either because you have an aneuploidic embryo, meaning you have a chromosomally abnormal embryo. But interestingly, miscarriages can happen when there's nothing wrong chromosomally. Why is that? Well, there's something called IUGR, which means intrauterine growth retardation, or IUFD, intrauterine fetal demise. And these are things that cause miscarriage. And what's the mechanism of action in these pathologies? Not enough blood flow to the placenta, or not enough blood flow initially to the yolk sac, which is kind of the preplacenta. It's the It's the sac that nourishes the developing embryo before placentation occurs. So when you use acupuncture and herbal medicine, it's stimulating blood flow to this developing embryo, subsequently to the yolk sac, subsequently to the placenta, hoping, or I should say, helping to maintain a hormonal balance and a good blood flow to the area. Again, the blood is delivering nutrient products and excreting dead cells. And so, using acupuncture and herbal medicine can definitely help to reduce IUGR, or intrauterine growth retardation, or intrauterine fetal demise. What about low level light therapy? What does that do? Low level light therapy has been shown to improve and increase mitochondrial function in the eggs and the sperm. Mitochondria are the powerhouses of the eggs or the sperm. And as a patient gets older, the mitochondrial integrity starts to diminish, and therefore, this is another pathway to poor egg quality or poor sperm quality. So, low level light therapy improves and increases mitochondria in the sperm and eggs, making them healthier. If you'd like more information or you'd like to schedule a consult with me, please visit our website, which is berkeleycenter.com. That's BERKLEY center.com. I'm in New York City. I also do telephone consults anywhere in the country, anywhere in the world. And of course, what I do after the consult is I send you a acupuncture prescription, so a local acupuncturist in your area can treat you appropriately. And I also write you an herbal medicine prescription that you can buy here in New York City or buy wherever you live. It was a pleasure speaking with you. I hope this was an informative video and an inspiring one. And thank you very much for watching, and Godspeed on your journey to family. Thanks so much again. Have a great weekend. Bye.